Welcome, everyone. Thanks for taking the time to learn about the BPI Healthy Housing Principles Certificate and the amazing new reference guide. Special thanks to Kevin and Christy Kennedy for creating this industry-changing reference guide. And special thanks to Joe and our team of subject matter experts from across the industry who helped bring this new guide to the market. Today, we're going to introduce the new Healthy Housing Principles Reference Guide. The guide is organized into 8 chapters called the Keep It Principles and what they mean to you and your business. We'll discuss the difference between the Healthy Housing Principles Certificate and the pre-existing BPI Healthy Home Evaluator certification. Also, we'll talk about what consumers are looking for to make their homes more comfortable, healthier, and safer. And lastly, how the Healthy Housing Principles can expand your knowledge so you can better serve your clients and customers. I'm Larry Zarker, CEO of the Building Performance Institute.
I'm Kevin Kennedy, Program Director for the Environmental Health Program at Children's Mercy in Kansas City.
Hi, and I'm Joe Medosh. I'm a Healthy Building Scientist with Hayward Score. So one of the things we wanted to talk about are some real life circumstances as to not just what motivated BPI and others to come up with these types of credentials and now a new certificate, but we actually have somebody on the line today who can explain a real world circumstance, and there's a blog that you actually can go to and read about what happened to Larry.
Right, so I lived at the bottom of 2 hills and we had a lot of water in our house, and my kids ended up having issues with respiratory issues in the fall. And one of the building analyst trainers came to my house at one point and said, "Why do you have so much water in your basement?" And so I started down the path of learning how that was impacting the health of our family. So do you see anything wrong with this built-in bookcase? This is a house that's only 30 years old. And if you look at the bottom shelf, it started to rot out. So I pulled all the books, I pulled all the trim, and we can see that as I removed the trim and removed the bookcase and exposed the drywall, and then I exposed the bats and the framing, there was a serious amount of rot there, and there was mold. And it came because of water penetrating the concrete masonry unit walls into the basement. So there's a heat pump outside of that wall, and we did a water test to actually look at how the water was getting in. And this is something that, you know, I would recommend for any of it. If you're working on equipment and you see that there's water getting in, you may need to go down and see what you can find. After a 3-inch deluge, that was all of the water that we got into the basement. But remember, with the bookcase in place, it couldn't get back out. And that little bit of water actually produced this kind of damage in the wall. So it was a real learning experience for me. So a few years ago, about 7 years ago, we introduced the Building Science Principles as a certificate of knowledge. So there's a reference guide and an exam. We have now 4 certifications: the building analyst, multifamily building analyst, QC inspector, and energy auditor that serve as prerequisites for the BPI Healthy Home Evaluator professional certification. And we're really glad today to be introducing the Healthy Housing Principles Reference Guide that is now available along with the Certificate of Knowledge exam. So we have companion parts, the Building Science Principles and now Healthy Housing Principles, again, organized around clean, dry, pest-free, contaminant-free, safe, ventilated, comfortable, and maintained. The reference guide is something that you can use in an open book environment in taking the Healthy Housing Principles Certificate exam. So when you pass that, you actually earn 8 CEUs that you might want for maintaining one of your other certifications. So the target audience here is really broad. We think that, you know, everyone from inspectors to weatherization technicians, home performance contractors, but also the people in the medical community, community health workers, in-home nurses, asthma educators, inspectors, realtors, and even students. This is a broad group of people that we've targeted for this new certificate.
So these are the fundamentals that have been used in HUD, EPA, anybody who decided that they tried to come up with a healthy home principles. These are it. These have been around much longer than I've actually been in the industry. And they were designed to be something that could be communicated easily with the occupant, as well as something the contractor could then use as a tool to advance more. So you could focus with your clients or the occupant about, let's keep it clean. And that's a very simple concept. Meanwhile, you, the contractor, or you, the person who's assessing the home or working with the occupant, understands a more what are the things behind these values. So we're going to go through these in terms of how they are somewhat late in the book, and make sure you understand the value that has been really put together. So I personally think this is going to be a major game changer in terms of how anybody who's going to a home, normally we've been focused on energy. Now we have the ability to broaden our vision and understand how to communicate with the occupant and understand more ourselves about how these conditions actually impact the home and the occupant together.
So the guide is organized by the 8 principles. Keep it clean as here in this guide, used as chapter 1. And these are some sample pages from Keep It Clean and from some of the other chapters. So what you can see is that it's nicely organized with the basic information and lots of graphics and figures to support what's written in the document. Each chapter has a set of learning objectives and important terms, and they provide the overview for the chapter. So for Keep It Clean, you can see that what we'll cover are the basic concepts of why keeping a house clean is important to health, that anymore cleaning is about health and reducing exposure. It's not simply about making a house look nice. More people are concerned about indoor health, and cleaning is a critical part of that keep it process. Chapter 2, Keep It Dry, of course, is about moisture management, but it provides a nice overview of like Larry's house and the issues that happen with moisture getting into homes. This shows some of the principles related to moisture movement and management. And you can see from the learning objectives, we'll also cover what some of the health impacts are of excess moisture and excess dampness in homes. It isn't just about leaks, it's about long-term chronic dampness. And the guide does a nice job of covering the concepts related to moisture, so you understand those, as well as how moisture can lead to microbial things growing in our homes, and how to better manage moisture to reduce the risk of those microbial things growing. Chapter 3 is about pest-free. And again, because it has nice visuals and nice examples of the principles related to pests, it's a good guide for people understanding the common pests that we don't want to see in our homes, and some basic information about each of those pests, as well as effective ways to manage those pests. So we'll cover the health impacts of pests, and what you'll find that is surprising to learn and is in the guide is how common pests are actually in homes, regardless of people's income or what part of the country they live in. Everybody is trying to deal with or manage pests at some point in their home. And the guide advocates for integrated pest management as the most effective approach that minimizes the use of chemicals and teaches people practical ways to manage their home to avoid pests getting established. Chapter 4 is called Keep It Contaminant Free. And here the focus is on the common chemicals that are either introduced into homes or are produced in homes just from people's daily routine or the products that they might use in their home, either to renovate the house, to repair it, to decorate, but also as part of the cleaning and maintenance. You can see there's lots of key terms and chemicals that you'll learn about in Contaminant Free, learn the basic information about all of these different kinds of contaminants, not just about the health effects. That's important and that's in the guide, but you'll also learn some of the recommended best practices for reducing the level of contaminants in your home, along with links to all sorts of really good resources for finding good alternatives to traditional products that might have contaminants that you don't want to have in your home.
So we're about halfway through. These are all, when they started, I probably introduced them as like really simple concepts, but you can understand now the depth that has gone into them and how you can understand the detail that really goes behind such a simple phrase as keep it safe or keep it clean. So keep it safe is also a part where you may start to realize that now there's some overlap. Now you're seeing chemicals, and we talked about contaminant free. Safe also goes in part of that. So there are places where these things are not always by themselves and they do overlap, but you can understand that trip fall hazards are one of the most significant things that happen in a home in terms of a healthy home and how that distinguishes itself from indoor air quality. And there's a variety of conditions here that we refer to and educate you about things you should understand. So not just things that are trip fall, but the chemical exposures, flammable poisons, understand the key words and signal words, other things that you may have taken for granted when you walk through a house about window guards or other types of circuit breakers, which you may not even look in the panel. You'll now have a great reference tool to understand what these things are and come back to them and see that some of the impacts that actually happen on the occupants. Keep it ventilated is, I feel, that one of the greatest missing links and strategies and information or references, however you want to describe it, in our entire industry. No matter what you're doing, ventilation is just such a vague kind of concept. So this book addresses why ventilation is such a healthy component and something that's missing from so many homes. You'll now have the ability to communicate, understand, evaluate these strategies and how they come into play, not just from carbon dioxide, but carbon monoxide, which is something you may be more familiar with, but we're going to understand what are the ventilation rates, airflow, leakage, pathways that are happening. So all these things come into play in terms of things you may normally be doing as part of an energy assessment or just things you may not even look at the home have now come into play with what are the health impacts on the occupants. So we will clearly go through, why ventilation is such a necessary component and good ventilation versus just that which flows through the house indirectly. Keep it comfortable is a foundation for many of the people that are listening to this webinar or this recording, because the concept is that you're probably at the home because there is some type of a comfort condition. You may be consulting them on other things that are happening to them emotionally or challenge or asthma, but you are usually inquiring about, are they comfortable? Is the environment working well for what they need? And this chapter does a great job of actually understanding what those things are and how to talk to the client and understand what it is you can do to engage them more to try and get more information out of them, and understand some of the things that may be kind of technically like hypothermia, we're not going to teach you how to do a programmable thermostat, but you should understand why those things can have value. And other things you understand if you are, for some reason, going to a attic, understand what heat stroke is and how to assess that, or to be able to identify that for somebody who's low income in a home that could be well over 95 degrees. So these are some things that I think are just a great asset in general to have, no matter what type of assessments you're doing at a home. And the last one, which I think is a great way to finish it off, is the foundation, is to keep it maintained. It is just one of the things that allowed everything else that was 1 through 7 to now actually become a minor issue or a significant issue when maintenance is not well kept up. So these are not just things for maintaining the outside, but also maintaining the inside. And you can start to see that there's, again, some overlap here, like, is asbestos a contaminant, or no, this is also part of the things you're dealing with maintenance in terms of making sure it's not friable and other conditions that you're able to identify and make sure the occupant also understands. I personally think that this book works on every level, that you can actually be just somebody who wants to learn more about how to make my home healthier, to somebody who's actually going in and working with occupants to educate them on how to make their home healthier. So let's do an example. So let's talk about some moisture intrusion. So this is bad drainage where the gutters are not moving away, and this compounds itself, that the more water stays near the foundation, it makes it sink lower and lower and lower. So every time they have a rain, significant or not, they're ended up with water that's near the foundation, and that water has to go somewhere. So that it's actually going inside to the lower areas. And even if there is no basement, it's still working its way into the house, and it's a moisture issue that you have to deal with. You may have mold on the inside walls, whether it's a basement or upstairs. So now we have a visible condition of moisture. So moisture will actually show up not just in water stains, but now once it has the right conditions, it now is mold. That is a direct condition that can actually lead to asthma exacerbation. Several triggers that can do that, and this is actually one of them. So it can actually cause an asthma attack with significant conditions and exposures, but it can just generate exacerbation, right? Somebody who has that, or even COPD or other conditions. So now we go back to our moisture issue, and now it's also causing structural damage. So now we're back to what's it doing to the impact of not just the occupant, but also the house itself under long term. So structural damage usually allows for pests, flaking paint to happen, potential fires, injuries. All these things are, again, because the maintenance wasn't bad and moisture is intruding, and you can start to see how contaminants and other things and pesticides are now entering this lifestyle of the person in this home. So now that we have pests, again, we have poisons. We have things that people are trying to do to combat roaches and pests. And you'll learn more about that. These kinds of things not only are not healthy, but actually many of them are not that effective. And you'll learn why integrated pest management can use some chemicals, but in general, you're trying to get rid of harborage and moisture and food sources as the primary reason why they're in your house. So when you can eliminate these things, you've reduced that. So now we've got pests and pesticides. Again, we're back to impacting the occupant. Asthma and allergies are now exacerbated. And now we have pests, so we have potential of risk of poisons in the foods for small children. A variety of things are done because you're really panicked about the things that are happening in your house and don't realize that there are repercussions that actually do that. So we got food based on the pesticides. And you can see just one simple example as to how the home is a system and how one thing impacts the other, and how even though you may think you're trying to get rid of rodents with a pesticide, there's a major impact that can happen to the occupants in other ways.
So we know that people live in homes around the world that are designed for that particular environment or that particular climate. Historically, people have used materials that were available local in order to build some kind of shelter. This is briefly touched on in the guide, but really the idea is that all shelter is built, designed, constructed with the intent of maintaining a similar indoor environment, regardless of what part of the planet one lives on. You're trying to maintain the temperature, the humidity within a certain range where people are comfortable, and ideally where the air quality indoors is good as well. So an important concept that most of you are familiar with, that's been around the home performance industry, the energy efficiency industry, and really the healthy home industry for the entire time of the industry's history is this concept of a house as a system, that homes have systems, those systems work together, whether it's the mechanical systems, whether it's the structural systems, the connection between individual rooms, the roof and its connection to the basement, all of it is connected. And a common way of describing these is shown here on the slide, where we think about the pressure, air pressure of moving through the house, the difference in air pressure leading to different kinds of air movement or pathways of airflow. Those pathways are also exposure pathways. That's where contaminants can be carried from one part of a house to another part of a house. Those contaminants would be the pollutants, whether they are outdoor pollutants that infiltrate inside the house, or whether they are contaminants that come from inside the house and are carried, for example, from the basement up to an upper floor where someone is sleeping, where the people are. So there's a connection of those 4 Ps, and it is the house as a system that makes that connection. And that is a key part of this guide. Each chapter of the guide touches on the role of house as a system for each of the Keep It principles. All of this matters because there's a much greater interest these days in our homes and the impact they have on our health. And part of the reason for that is people don't manage their health in a healthcare facility. They don't manage their health at a hospital or a clinic. You might visit those places, but you really manage your health in your home. And the home is a vital part of our health. And more people have some kind of chronic health problem that can be associated with the conditions in their home. So that combined with their daily activities and their behaviors can contribute to exposures that make their health much worse, or through effective management of their home, by having good materials that the house is made from and a good mechanical system and good ventilation, the house could actually promote occupant health. So it plays a key role in our long-term health and well-being. This matters because there are, unfortunately, more and more major chronic health conditions that affect a larger and larger portion of the population. And just one example in our country is asthma. Asthma is a major environmental disease. It's a chronic respiratory disease. You can see from this map the number of people in each state who have asthma averages right around anywhere from 6 to 9% of the population in each of these states. Nationwide, it's just under 10% of the population has this chronic environmental disease, where people are exposed to certain things in their environment that can lead to major health problems. And the costs are staggering. This shows on an annual basis $56 billion in total costs. That's $50 billion in direct costs and $6 billion approximately in indirect costs related to missed work or being absent from school. Those costs are for people, and they are usually because there's some kind of exposure going on at home that they're trying to manage, some trigger that might occur in a home or in a school. That direct cost averages over $3,000 per person each year. This is a cost that we can control by how we manage our homes. And this is something that consumers are particularly interested in, and this is why this guide is so important right now. This new report from Harvard's Joint Center for Housing Studies specifically surveys consumers about their concerns. And in this case, it's specifically about concerns related to the home and decision-making they may make related to healthy home remodeling and renovation of their home. And you can see from this chart that it is new homeowners, young people who are more interested than ever, especially those who have children, who are very interested in investing in their home in a way that makes the home healthier. So they need guidance. They need the experts who do this work as a profession to have a healthy home background, to have professional knowledge so they can offer effective guidance to these consumers. We also see from this slide that it is those younger consumers that are homeowners. So it's those between 25 and 44 who are becoming homeowners, who own a property and who want to invest in that property, but they want to do it in a way to make the house healthier for them and their new families. And what are their concerns? They are particularly concerned about indoor air quality. Many of these are families, unfortunately, where the parents may have a chronic respiratory disease, or they have a new child and that child unfortunately has a chronic respiratory disease. So indoor air quality is very important to them, as is whether they have pests or not. This, again, from that report shows that one of the primary drivers are the symptoms that people have. They have symptoms and they seek advice for how to address their home, how to change the ventilation system, whether they need to upgrade their filters, whether they need to change the kind of products they use to manage their home. The survey shows consumers are paying attention to these issues and they want help.
Many of the people that are the first adopters of what BPI has released in terms of certificate, maybe those that are already associated with BPI, many of those are doing energy assessments and comfort consulting and those kind of improvements. So I wanted to try and explain that many of the things that are part of the Keep It principles are the things you're doing already. So there isn't a disconnect between that, what you think of as energy efficient or energy measures, or when you're evaluating a hot water tank or a furnace, those are safety conditions and those are contaminants. So you can see that there's a major overlap as to what you're already doing. And our goal is to broaden your vision as to other things that you could be communicating with your clients, adding more business opportunities, and also to demonstrate that many things you do actually have some type of healthy outcomes, whether they're reducing these contaminant pathways or reducing allergen triggers, and able to talk to a client who says that, yeah, my child has asthma. There are sections in this book that actually help you to understand what that really means and how to actually have an active dialogue with them, so you understand what are their concerns on an empathetic level, and then be able to recommend things they could be doing in their home, from anywhere from vacuuming to actually filtration. So there's a variety of things that it proves here. Ultimately, your goal is to make sure that people have a happy, healthy, comfortable users. That's really the goal for everybody, whether you are somebody who's actually doing the work in the house, or just somebody to come in and consult with somebody because they had an asthma attack and had to go to the hospital. So all this stuff you can see is clearly is connected well to everybody. One of the things that you should be understanding, in fact, it's really probably the most forgotten tool that we think about, is your ability to just use your hearing, your vision, and your smell when you're in the house. These are the kind of things that actually tell you more about it than trying to do a survey or talk to people, all right? That these are the things that actually you can see, I can instantly feel and touch when I'm in the house. As well as we're going to start encourage you to look in places where you may not have, or not overlook things you may do. You may look underneath the sink because you're looking for some type of air leakage or potential moisture issue, and you're moving chemicals out of the way. So you can see where there's an overlap between explaining to people that some of these things are kind of hazardous, or you have kids, I didn't see safety locks. And there's also a way to communicate these best practices. So the guide has got a lot of great information that you can use to communicate with your client, and again, improve the opportunities that we think are inherent. And every time somebody goes to the home, to either just educate or provide other services that you may not have actually included. As I mentioned, we think that, I believe personally, and many others, that the occupant is the primary receptor. And not just me as somebody who's going into your home, but even the occupant themselves. You may take in a bunch of sophisticated wands or magical things, COVID detectors, or whatever you think is out there today, and try to do an assessment of the house, when the person who knows the most about their conditions, what they're experiencing, is the occupant. So just because your meter says, I can't read anything, your home must be fine, that's not the case. That somebody could be actually having headaches or nosebleeds or a variety of stuff, and these instruments are nowhere sophisticated as we are as human beings. So we encourage you to think about as not just these gadgets or other things that you think are improving your way to work with an occupant, is that they are actually the most primary tool that you can use in terms of getting them to help acknowledge where they're having these conditions and how to work with them. This book is full of chapter after chapter about things you could be doing and learning about more exposure conditions in that house and how to reduce them.
A lot of professionals are interested in being able to engage clients to talk about healthy home issues in the home. And part of their anxiety is they feel like, oh, healthy homes mean I need to talk to people about their health. Well, that's true. It's important for you to learn about what people's health concerns are. But the reason you want to learn is because you're wanting to understand what health conditions people might be dealing with, and through this new guide, have knowledge about what common environmental problems might be associated with certain kinds of health problems. So you don't need to necessarily learn to advocate for how something could be changed to improve somebody's health. Your goal is to say, we can improve the home and therefore improve the environmental conditions in the home. That is the goal. The goal is to make the home the best environment it can be. There's no specific relationship that you can guarantee to anybody that you're going to improve their health because they change the environment in some way. But the research evidence shows that if we change home environments and change the conditions by applying the Keep It principles, that anyone living in a home that has the Keep It principles adopted in an appropriate way should find that their health improves. So the guide provides you a connection to what the research says about each of these Keep It principles. And that's really what's important, is it gives you direct evidence to support the knowledge you need when you make recommendations for the home environment. After taking this guide and learning and getting this certificate of knowledge, there would be other training opportunities to advance your knowledge further. And that is the goal here, to give you an opportunity to really expand your knowledge about home environments. Especially in the time of COVID-19, more than ever, people are seeking expert advice about home environments. They're particularly concerned about exposure risks, and many of the Keep It principles apply as one looks to manage their home. Obviously, keeping a home clean is one that many people are focused on as they think about cleaning and disinfection for eliminating the virus. And disinfection is an important step, but cleaning must take place first. So it's important to apply Keep It Clean, but also to apply Keep It Ventilated. It's important to understand how air might move through a house. And many people are seeking advice from professionals on how they can set up their home systems, mechanical systems or airflow or use of fans or portable air cleaners, whatever technology there is, what kind of technologies they can use to make their home as safe and healthy as possible in this time of COVID.
Okay, so let's talk about the healthy home business opportunities. In this time of COVID, as Kevin was mentioning, there are a lot of people who have been hospitalized who come back home. So that is one kind of situation where you may be able to do things in the home that can improve the occupant experience there. Asthma, and as Kevin mentioned, asthma and respiratory infection trigger assessments in homes. Aetna has estimated that a trip to the emergency room costs $880, and a visit in the hospital can be over $8,000. If you look at 2 or 3 or 4 of these experiences in a year, that gets to be real money. And we'd like to see managed care understand that these kinds of investments could actually reduce their outlays for patients. And you know, who better than this audience to look at trip and fall hazards in homes? You know, that Medicare pays over $30 billion dealing with injuries from trips and falls in homes. These are things that you can actually have some impact on. Moving on to the next one, Medicaid is now starting to reimburse for the Healthy Home Assessment through our Healthy Home Evaluator certification that is now available. And as some of the utility programs are moving away from just energy efficiency improvements to consider comfort, health, and safety, this provides to you new opportunities for building a business around the healthy home environment. So again, looking at these target audiences, this is an opportunity for you to look for collaboration with some of these stakeholders out here who may get engaged in going into the home for one reason, like community health workers go into the home for one reason. You may be doing air sealing and insulation, and you could build a collaboration with them in order to have a greater impact in the home. So keep in mind, all of these people are related to it. Now, as you present your own business in your community, you say, well, how do I build this out? There are all sorts of health specialists in your community, caregivers, local government agencies like public health agencies that want to know that you have the capability. These are people you can talk to. You can speak with the educators, you know, the PTAs, what we used to call them. You know, they want to see that kids stay in classrooms and people don't have to take time off from work. Work with real estate professionals. One of our contractors goes to bridal shows. The reason is, as Kevin pointed out earlier, once they get married and they have kids, there's a real concern about the quality of the life in the house. And so if you are in front of them early on, they'll come back to you to do work. And then lastly, you know, work with the local media. You can become that person who's the go-to person around healthy housing. So we have a new website, bpi.org/HHP, that I encourage you to take a look at. It provides information on the reference guide as well as the Certificate of Knowledge exam, but it also has a whole set of 8 different types of resources that you can access and go in and find out about, you know, scoring systems and checklists or key reference materials. We're constantly updating that. If you know of a report that we don't have it included, we will include it. And the PowerPoint that we're using today is available on our website as a PDF for you to download. All you have to do is go to bpi.org/HHP_presentation, and you can download this, the PDF of this presentation for your own use.
I want to point out one of the key things that makes this a powerful tool is that if you would have put all this in the book, it would have been old news by the time the end of the year it happened. So what's amazing about this is that you're able to constantly update it. You can find new resources or things that are no longer valid that can be updated and removed. So I think it was a great choice to put this online for all those, even if you have not chosen to get the book or the certificate yet, this is still available for you to use, and you'll realize now I need to go order this book and get this certificate. So well done in terms of providing a wealth of resources for people out there, Larry. So we are in conclusion here. So it's in the news. It's common things. People are talking about it more, even before COVID had overwhelmed us right now. That people want to change the way they view health in their home and their environment. These are things that new buyers and people who are buying existing homes are talking about. People are upgrading their home and are now asking about what type of material should they be using. Should they go to solid surface or hardwood floors? All these things are now the things that are much more on the forefront of people. Even if you don't have a spouse, or you have asthma yourself, or somebody in your house has those kind of conditions, you're now kind of a little more sensitive to that. But if they do, you're hyper aware of the things that are in your environment and what you can do. So we're really happy to see that these things are on the forefront. And let me remind you that energy reduction and conservation was started in the 70s. And it really took us until sometime in the 2000s before it really kind of moved forward as something that everybody was doing and utilities were getting involved with. I do think that this is where we're headed. So comfort, health, and safety are driving consumers' decisions. And these are things that they think are actually able to provide a great investment in their house and their family. So we encourage you to use these tools appropriately.
Well, the truth is that many people, as I've said, are dealing with chronic health conditions. And the healthcare system does the best it can, but people do not want to spend all their money on going to a clinic or going to a hospital. And really, the healthcare profession is starting to think more about preventive health measures, about doing things proactively. So they call this concept upstream medicine. Let's look upstream at what the causes of health problems are. And guess what? Many of those causes are found in homes, and the cause is related to exposure in a home environment. So we need experts, people with knowledge about healthy homes, who can apply the skills of visual observation, who can use their diagnostic tools and other diagnostic tools in new ways to better inform about what potential exposures might be going on in a home environment, and what interventions and actions consumers can take to make their home environment better. People are going to spend money on their home. They want to do it in a smart way. They want to do it in an effective way that makes their home healthier and safer for the people who live there. So they need people like you who are going to take this new knowledge you gain from the reference guide and use it to educate people in how to do effective, healthy home management. And we recommend that not just you have the training, but really all of the staff in your business, whether it's the person at the front desk or whether it's the person who's driving the truck to get to the house to do the work. All of those people would benefit from having a common background in the healthy home principles.
This certificate does not require any additional education, right? You can just order the book online and take the exam online. But there are a variety of trainers that are out there that are BPI and others that will be offering this. So if you're looking to get more in depth into what the book may offer, or want to just learn more as to what else is out there, or how do I do some of these things, starting in August, you're going to see a variety of folks offering online training, personal training, or a combination of those. So look for those, and I'm sure there'll be some resources sent out from BPI.
And keep in mind that the certificate exam is open book. So you get the reference guide, you can have that available to you to reference while you're taking that exam.
And I personally feel that this is the kind of thing you're going to walk into the house with, right? So this is the kind of reference guide where you're in the house and you want to talk about something, and it's impossible to memorize the depth of knowledge that's in this reference guide. That's why it's referred to as a reference guide. But it's user friendly and picture friendly, so you can open it up and share with somebody. You're like, here's what I'm trying to explain to you about this condition, and you can read it together. So, or show them what it is. So I think that this is going to be something that works for, again, all levels, homeowners, contractors, and everybody in between, as to how they actually understand the missing link between health and your environment.
So here's our contact information. I want to thank everyone for joining us today. and feel free to reach out to us if you have any questions or issues.
Thanks, everybody. Thanks for spending the time with us. Be safe.
Thanks for listening. We appreciate it.
Yeah. Thank you.